Lungs. Definition: the lungs are a pair of breathing organs located with the chest which remove carbon dioxide from and bring oxygen to the blood. There is a right and left lung.
Lung cancer is the leading cause of cancer deaths in Malaysia for both men and women. Your lungs are two spongy organs in your chest. The left lung is divided into two lobes, or sections, and the right lung has three lobes. When you breathe in, air enters your nose or mouth and passes into your trachea, or windpipe. At the carina, the trachea divides into two bronchi, then branches into smaller bronchioles. The bronchioles end in tiny air sacs, or alveoli. Here, the oxygen in the air you inhale passes into the bloodstream, and carbon dioxide from your body passes out of the bloodstream. The carbon dioxide is expelled from your body when you exhale. Your lungs are encased by pleura, a thin membrane that protects them and helps them slide back and forth as you breathe in and out. Underneath your lungs is the diaphragm, a smooth, thin muscle that helps your lungs expand and contract as you breathe. Your lungs are connected to small collections.
This animation will show the changes that occur in the lungs if you have chronic obstructive pulmonary disease. Click the navigation arrows below the animation screen to play, pause, rewind, or fast forward the animation. Air passes through the trachea and bronchi to the lungs when you breathe. Chronic obstructive pulmonary disease, or COPD for short, is the term used to describe long-term conditions affecting the lungs which cause breathing difficulties. COPD is mainly caused by smoking cigarettes. People with COPD can have the conditions chronic bronchitis and emphysema. Chronic bronchitis affects the
Disease. Short obstructive pulmonary disease damage to the lungs resulting in difficult blowing air out, causing shortness of breathing. Smoking is by far the most common cause COPD. Emphysema, a form of COPD usually caused by smoking. The fragile walls between the lungs are second alveoli are damaged, trapping air in the lungs and making breathing difficult. Short bronchitis repeats frequent episodes of progressive cough, usually caused by smoking. Breathing also becomes difficult in the form of COPD.
This animation will show what happens in the lungs during an asthma attack and how a reliever inhaler works to treat it. Click the navigation arrows below the animation screen to play, pause, rewind, or fast forward the animation. Air or oxygen is taken in through the mouth and nose. It then passes through the trachea to the bronchi. Asthma is a condition where the airways become irritated and inflamed.
It's helpful to visualize the underlying lungs and their lobes. Anteriorly, the apices of the lungs usually rise 2 to 4 centimeters above the inner third of the clavicle. The inferior border of each lung crosses the 6th rib in the mid-clavicular line and slopes downward, crossing the 8th ribs in the mid-axillary line. Posteriorly, the lungs extend from above the scapulae to about the level of T10 on quiet inspiration and to T12 on deep inspiration.